you're not yet convinced that losing that belly fat and improving your metabolic health is a worthwhile endeavor, hopefully after listening to this podcast, you'll be motivated because scientists from Italy uncover for the first time a novel mechanism that connects the dots between obesity, poor metabolic health, also known as insulin resistance, and high blood pressure, and how those conditions that have been known to increase risk for landing in the ICU or dying, or even having really long-term complications from this now endemic coronavirus. That is, SARS-CoV-2 is not going away, friends. It is now endemic. We're going to have to live with it. And this new paper really should help motivate the people in your life and possibly yourself for improving your metabolic health by way of compressing your feeding window, eating less processed food and probably lower quantities of carbohydrates in your diet, regularly exercising, managing your stress, and focusing and prioritizing on your sleep. Because it turns out that healthy living can decrease the quantities of the visceral adipose tissue. And the visceral adipose tissue is the problem. And we're going to dive into it right now. So in brief, scientists in Italy found that debris from overfilled fat cells have been shown to circulate throughout the body and cause liver and respiratory distress that ultimately manifests in severe COVID-19 complications. And there's a lot of similar overlaps here between fat embolism syndrome, known as FES. We'll define what that is. This is a multi-organ failure that could be potentially lethal, and it's commonly seen in polytrauma patients. So individuals who have had pelvic floor and long bone, multiple fractures from, say, a collateral damage from a car accident, where you have pelvic damage and you have long bones that have been crushed and they're releasing, say, bone marrow and fat. It's common to then have a reduction in blood oxygen saturation, respiratory distress, systemic inflammation, confusion, mental challenges, and all of this that mirror what is commonly found in severe COVID-19. And so this has been long known. And these researchers in Italy were one of the first to make this observation and say, well, guess what? We know of this clinical situation known as fat embolism syndrome. And it seems that there's a lot of shared futures. And upon two of the autopsy studies, this researcher here, his name is Cinti, I believe, in Italy, he was one of the first to make this connection back in 2020. And his lab has since now done some cadaver studies. And we're going to look at the histological changes in the fat cells, in the liver, in the lungs, in obese individuals who succumbed to COVID-19, comparing that and contrasting that to healthy controls who did not die of COVID. And what they found was just fascinating. So let's really dive into it. Now, sort of the thesis here, the elevator pitch is insulin resistance creates overfilled fat cells. Those overfilled fat cells get infiltrated by macrophages, which is a part of your innate immune system. And that can cause this necrosis within the fat cell itself that can release or cause this lipid spillover and inflammatory debris. That inflammatory debris, before it can go in your lungs, it has to go through the liver. So then it causes collateral damage in the liver, which, by the way, they found in these COVID patients in the cadavers, in the autopsies, and then it goes to the lungs. Now, in so doing, there's all this lipid spillover, and that causes narrowing or occlusion, stenosis of the vessels that compromises blood vessel function. That leads to then lowering of oxygen delivery, increased risk of clotting and coagulation, embolisms, and thrombosis and so forth, and then that can lead to severe disease and complications and all of this. So there's a lot of overlap here. Here's just an image to give you an idea of the fat cell. And you can see here the overfilled necrotic fat cell that's been infiltrated with overfilled lipids. So again, insulin resistance, hyperinsulinemia, exercise insufficiency, hypoxia within the fat cell, and you get this lipid spillover. So what's interesting is, though they had, I think, 18 cadavers they looked at that died from COVID and 20 controls, is that in a significant amount of controls that didn't die from COVID, they still had these challenges within the fat cell. So we should be making the main thing the main thing. We're hearing so much about masking, washing our hands, making sure that our kids get immunized and all of this sort of stuff. But we don't hear so much about things we can do to decrease the big problem, the obesity, the overweight, the insulin resistance problem. And so this is a new mechanistic study. So you saw the image here. Now, again, there's a few takeaways before we dive into the details, because the details I think are important. I know you like the details, and I know you like the big picture and the practical takeaways. The practical takeaways is we have to improve metabolic health. We do that not just with pills. We do that not just with immunizations. We do that with our lifestyle, okay? So this starts with our sleep and stress management. We're going to dive into that in a moment. This starts with circadian rhythms. So we need to get light in the morning, dark in the evening. I'm not practicing that right now because it's like 8 o'clock. You have a bright light on me, but this is important to share this with you, okay? We need to focus on exercise. We need both a combination of short duration, high intensity interval training, comparing that with resistance training. So 150 minutes cumulative per week. That half of those minutes should be intense, okay? We talked about stress reduction. That's really important. And then we also need to, I think, focus on breath work and meditation. That's a big part of it. But some other big takeaways here is as we dive into the nuances, we're going to talk about fat cells. And I don't want you to just think about the visibly overweight and the obese, because there are some overweight or even obese people who, guess what? They are fit and fat. Okay, that is a thing that literally scientists talk about that. So we need to realize that being fit even is protective, even if you're overweight or obese. So you're not doomed if you're overweight or obese. That's number one. Number two, even if you're skinny, you are not totally protected. About 30% of individuals who look skinny are fat on the inside. They have metabolic obesity. They have high levels of the visceral fat that we're going to dive into very soon that is very problematic. That has, again, the visceral fat, the infiltration of immune cells, high levels of leptin, the spillover, and the dead necrotic adipocytes or fat cells. Visceral fat, my friends, is the problem. There's plenty of people who are overweight that carry it in the subcutaneous, back of the triceps, that carry it around the glutes or the hamstrings, but not in the deep abdominal region, okay? This might be why also men are disproportionately impacted greater than women when it comes to COVID-19. It's about 60-40 in terms of deaths and disease severity and the whole thing. So keep that in mind. We know that kids are not immune from developing visceral adipose tissue. Earlier this week, it was announced that the FDA has granted the emergency use authorization for various protective measures for children. Well, guess what? Children are historically on a large population level, largely unaffected by COVID-19. But the children that are impacted severely by COVID-19 probably have high levels at that young age of intra-abdominal visceral fat. And so therefore they could be at risk for this fat embolism syndrome that we're talking about and disease severity from COVID-19. So one of the first studies that I remember looking at when I was writing the book, Belly Fat Effect, it goes back to, I think this was published, I want to say in 2011, one of the first studies to show that 6-year-olds have increased concentration of, inflammatory milieu going on in their fat tissue. So part of the reason why, we saw the increase in obesity and overweight in children, and then later we saw more kids were getting hospitalized from Delta, could that be part of this? And so kids are not immune to developing the complications and pathology in their fat tissue that is normally seen in adults. We are seeing now, remember type 2 diabetes when you were a kid in school, you learned about this? This was called adult onset diabetes. Well, now we know that children are diagnosed with full-blown insulin-dependent diabetes because they have fat infiltration in their pancreas and no longer releasing sufficient amount of insulin and all of that. So kids are not immune to this. Skinny people can have high levels of visceral adipose tissue, and you can be fit and overweight, and that is better than just being overweight and sedentary, friends. So we're going to dive into this. The author here is Sinti et al. I want to share with you these details, but first, I want to welcome you back. It's Mike Mutzel. I'm grateful that you're here. Thank you for listening in iTunes. Thank you for subscribing, and thank you for leaving a comment and sharing this podcast. Wherever you're listening to this, if you could share this with a direct text message, that really goes a long way, friends, because these platforms are actually throttling back health channels for sharing, believe it or not, proactive health information. I know it's crazy, seems incongruent, but please leave a comment and share this. That really helps individuals like you. And also equally important, friends, this show is brought to you by our sister company, Myoscience Nutrition. We've talked a lot about stress and sleep management, and there's a lot of challenges going on, especially during the winter months, when the nights are really long. it can be hard to unwind. A lot of people, unfortunately, turn to alcohol and substances and end up binge watching Netflix. Those are not sustainable ways to focus on your sleep. We developed one of the most important, sort of robust, synergistic sleep enhancing formulas that can help you have a good night's sleep and calm down and unwind. It features magnesium, it features L-theanine, it features taurine, it features GABA, potassium, glycine, and inositol. There's not another combination out there, a multi-ingredient formulation that works synergistically, that's restorative on all these different pathways that can, again, help support whole body metabolism, help support electrolyte balance, and help foster that feeling of being calm and relaxed. So you can support your relaxed mood and help support your sleep by going over to Myoscience. That's MYOXCIENCE. That's myoscience.com. Check out the Myo Relax and Calm. Use the coupon code podcast to save. Okay, let's get into the study. I'm going to just try to get this done in like 5 minutes. I know a lot of you are just so busy with your life and your family and all that. So let's just make it count right here. So back in 2020, Cynthia et al. Wrote, we have found clear evidence of fat embolism in lung specimens from 2 adult COVID-19 patients, 1 male and 1 female, with overweight, suggesting that this might be a very relevant pathologic event with severe consequences for drug management. So this was, again, way before vaccines. They made this observation in May of 2020. Of note, lipid-like structures were also found in the lumen of mesenteric venous vessels in one of the 2 patients. So the mesentery is sort of like the omentum and the viscera. These words they're functionally or they're anatomically different, but essentially for practical purposes, when you hear viscera, you hear omentum, you hear the mesentery. This is all around the gut. So deep abdominal fat is linked with that's the problem, okay? Although there were no between group differences in body mass index and adipocyte size, there was a higher prevalence of the CD68 macrophages in the COVID-19 patient's visceral adipose tissue. So again, what this entails is high levels of lipid overload in large fat cells cause the recruitment of these innate immune system cells called the macrophages. And once they're in and around your fat, they start to release cytokines and cause local insulin resistance and local inflammation. This also causes local increases in prothrombotic milieu or mechanisms. There's plasminogen activator inhibitor 1, there's fibrin, there's all these different factors that enhance the formation of blood clots and slow down blood flow. And this is driven by this inflammatory process. So being that visceral adipose tissue inflammation is associated with this stagnant blood flow and then also lipid spillover from dead fat cells known as adipocytes, dead adipocytes, they studied the lipid distribution by employing this sort of staining technique called this oil red O staining. And what they observed here is that lipids within the livers, the lungs, and the fat tissue were concentrated via looking at the staining under the histological markers. They found macrophages and endothelial cells were infiltrated with lipids, and this suggests this fat embolism syndrome that was more prevalent in the COVID-19 patients compared to the controls. And they said signs of embolism were more prevalent among the obese, independently of COVID-19 diagnosis. This is important. So if you're obese, and especially if you don't exercise and you eat processed food, well, guess what? These lipids are infiltrating your vessels, compromising your cells' ability to get nutrients, to get oxygen, to get waste products away. I mean, this is really important stuff. So this data suggests that this condition, such as obesity, is a complication exacerbating SARS-CoV-2 infection. Now, this is important because we've known that obese, overweight individuals are at higher risk for landing in the ICU and dying and all that. But there hasn't been a good mechanistic explanation for this outside of the fact that obesity is linked with a more pro-inflammatory, pro-thrombotic state. Individuals that are overweight, are prone to, having more thromboses and clots and things like that. And also, there's more mechanical pressure on the lungs and the inability to oxygenate. But this mechanistic finding shows that this lipid spillover further worsens things and causes the narrowing or the occlusion of vessels. So importantly, all infected subjects' lungs presented with lipid-rich stainings in these hyaline membranes. That's important. Remember that word, these hyaline membranes. And these are associated with COVID-19 related pneumonia and death. And so this is really important. So this was found in pretty much all of the COVID patients but not in the control patients in this group. They also went on to do electron microscopy studies showing that these signs of the adipocyte cell death were more prominent in the COVID-19 patients compared to the control. So this is what's important. Now, what the study couldn't find, because it's been proposed that perhaps because the ACE2 receptor is, of course, where the spike protein latches on, and that's how the virus, hijacks your own cellular machinery. Because remember, viruses are obligate intracellular parasites. They can't procreate and replicate and create new virons without your own machinery. So they need to latch onto your cells. This particular virus does that by way of the ACE2 receptor. It's been shown that there's a high concentration of this ACE2 receptor on fat tissue, but it hasn't yet been fully elucidated whether or not the virus is specifically infecting fat cells. Now, unfortunately, this study didn't totally suss that out. They weren't able to figure that out, but they did see virus material, RNA and stuff like that within the fat cells. But again, they didn't say that it was from that. They proposed that it could be two different things. It could be this infection, or it could be the collateral damage, and it just, from the inflammation that caused some sort of remnants of virus to then get inside the fat tissue. So that's really important here. Signs of fat embolism were in fact more prevalent among individuals with obesity than in those with a BMI under 30. Now, this is important. 93% versus 63%, p-value 0.03%. So signs of fat embolism syndrome more prevalent in obese compared to non-obese, independent of COVID-19 diagnosis. So that's important. Again, going back to how we introduced this video, metabolic health, reducing belly fat is very important. A lot of ways to do that. Focus on your diet, focus on reducing carbohydrate intake, matching your carbohydrate intake with your expenditure, with your exercise. If you're not exercising a lot, you don't need bowls of pasta and noodles and bread. I mean, let's just be real. And focusing on your sleep, stress reduction, circadian rhythms, really important stuff. They said that the lack of SARS-CoV-2 detection by qPCR did not allow us to conclude that such inflammation, cellular stress, and adipocyte cell death were related to the presence of the virus within the fat cells. They said it is in fact possible that the described visceral adipose tissue futures were secondary to the systemic inflammation induced by COVID-19 or due to the presence of different viruses within the fat cell depot. Important. Okay, so let's focus. There's just a few more paragraphs here, and then we're good. And you've hopefully heard the message. All right. So lastly, since the embolytic material from the abdominal visceral tissues should necessarily pass through the liver to reach the lung, we exploited this labeling lipid technique that they did the staining of the cells to show liver samples belonging to COVID-19 patients and also to controls. Liver samples from these autopsies showed focal macrovasculature steatosis. Steatosis has to do with lipid buildup. So there was lipid buildup within the vasculature in the liver, more significant in individuals who had COVID-19 compared to not. So again, this is just more evidence that severe COVID-19 could be linked to this fat embolism syndrome, which is, again, the root cause of that is not a vaccine deficiency. It's an overweight, metabolic, unhealthy state. And so we should simultaneously address these problems at the same time, and so forth. So in particular, signs consistent with fat embolism, presence of free lipid droplets into hepatic sinusoids, into the vessel's lumen, as well as clusters of lipid-rich structures in the portal vein. The portal vein is the main vein that exits out of the liver, were observed in COVID-19 patients. Okay, finding that the embolytic structure of hepatic fat droplets and support what is observed in the visceral adipose sample. So I know there was some jargon here. Essentially what they were saying is there's shared histological or functional changes within the fat cell and also in the liver. Now, we know this to be true. Overweight individuals who have visceral adipose tissue accumulation, belly fat, also have, there's a strong connection there because of, if you think about, you have a lot of fat in your abdomen, your liver's right there, right? So there's, build up a steatosis of fat within the liver. Your liver is a key metabolic organ. If your systemic metabolism screwed up because you're over fat, you don't need to be Dick Tracy to know that your liver probably has some fat buildup in it too. Your pancreas starts to build up fat too, as does your heart, and then that leads to all sorts of complications. So in summary, 8 of 9 COVID-19 subjects with documented lung fat embolism displayed signs of hepatic fat embolism as well. On the other side, we observed hepatic fat on the On the other side, we observed hepatic embolism as an elevated percentage On the other side, we observed hepatic embolism in an elevated percentage of controlled subjects, possibly due to the elevated prevalence of visceral obesity among these investigated cases. So, I know there was some jargon in here. Again, the take-home message here is as you accumulate belly fat, your fat cells start to die. They get overfilled. They get infiltrated with immune cells. They spill over. That lipid spillover goes to your liver, goes to your lungs, goes to your heart, goes to your vessels, and that causes a whole host of problems. So, as a society trying to save lives, to reduce disease severity, keep people out of the hospital, we should be focusing on improving the health of our metabolism, decreasing quantities of visceral adipose tissue and fat tissue. We should be making healthy living the main thing going forward, because there's other viruses that we're going to be exposed to, and most importantly, this virus is not going away. Now, I don't even want to go into the waning immunity associated with some of the things that people are getting right now, but we know that immunity doesn't last forever. So we should improve metabolic health. That's the main message. Hopefully you don't think I'm anti anything. I am just pro health. We should be making health the main thing. Exercising at least 150 minutes per week, matching our carbohydrate intake with our energy expenditure, our physical activity. We got to focus on stress reduction and sleep, breath work. We need to focus on getting the persistent organic pollutants, endocrine disrupting chemicals out of our food supply. We need to focus on circadian rhythms, our relationships, meaning, purpose, all of that. Really important stuff, friends. So hopefully you found this helpful. I will link these articles below. I want you to share this video, please, if it resonated with you. Thank you for hitting that like button. Thank you for leaving us a comment. Thank you for supporting our show sponsor, Myoscience. And hopefully you got something out of this. And we will catch you in a future video down the road. Until then, be well. Bye all.